We presented at ASCO this year a phase 2 trial of combining a CDK4/6 inhibitor called Palbociclib with Cetuximab, an EGFR inhibitor, in patients with HPV unrelated metastatic platinum-resistant head and neck cancer. The current standard of care for treating these patients is Cetuximab monotherapy that results in a tumor response rate of 13% and a median progression-free survival of 2.3 months and median overall survival of about 4 to 6 months. In HPV unrelated head and neck cancer, the Cancer Genome Atlas clearly showed that this tumor is driven by a combination of CDK4/6 inhibition through P16 and activation through P16 inhibition, along with cyclin D1 amplification. So it made sense as rationale for the trial to combine a CDK4/6 inhibitor, Palbociclib, with Cetuximab. And that's exactly what we did in this trial. This was a one-arm phase 2 trial. We treated 30 patients with a combination of Palbociclib and Cetuximab, and after every 2 cycles we assessed tumor response. The primary endpoint was tumor response, best tumor response, and the secondary endpoints were adverse events and progression-free and overall survival. We treated 30 patients, and the best tumor response rate was 39%, which was tripled that of Cetuximab monotherapy. The median progression-free survival was 5.3 months in comparison to 2.3 months with Cetuximab monotherapy. And the median overall survival was 9.5 months, which exceeded that of Cetuximab monotherapy, which was about 4 to 6 months. So this is the first trial that established the potential efficacy of a CDK4/6 inhibitor in head and neck cancer. This trial led to a phase 2 global randomized trial completed at the end of last year, which was a double-blind randomized trial of Palbociclib Cetuximab versus placebo Cetuximab in patients with HPV unrelated platinum-resistant head and neck cancer. We look forward to the results of that trial.